All right, I think we're ready to roll. Looks like everything is going. All right, and welcome to Back Talking, where today we are not here to talk about big mouth, bratty kids. We are here to discuss all things related to the back or spine. And I am Todd Wagurski, and I'm the host for the show. So I've spent the past 20 years in the trenches helping people with back pain. I'm speaking to you now from one of my treatment rooms as we just finished up the morning session of seeing patients. So this is what I do, and you get to interact with me live weekly. This show is my way to help those who are having back problems. So reach out to me at todd@backtalkinghelp.com. Again, that's todd@backtalkinghelp.com. I'd like to know what you're struggling with, and we'll try to find a solution to your problem. So the format of these blab episodes are what I'm calling spinal grand rounds, where I present a real-life case to you. This is someone's story and journey. These are real people that have walked through my doors. So you can follow along and maybe see the similarities between what you or someone that you know are dealing with. They're also meant to be educational, as I feel you can never have enough information when you're dealing with a bad back. So last week we talked about Jason, the young computer programmer who was dealing with a lumbar strain. And if you missed that, you can check it out at the website, backtalkinghelp.com. It's located under the video shows tab on the homepage. And you can also find the audio to these blab episodes on the website as well. And we're also on iTunes and Stitcher Radio under Back Talking. That's the name of the show. So without further ado, let me slide this across and get you hopefully on to my camera on screen. So again, here's my email address, todd@backtalkinghelp.com. And I also put my phone number on there, 919-439-4360. You can call me or text to that number, and I'd like to hear from you and let me know what you're dealing with and what's going on. And don't worry, everything is kept confidential, so no worries. I won't expose you on the air. So on to our Spinal Grand Rounds case of the day. So today we're talking about John. John is an 82-year-old retired cop from New Jersey. Back in the day, he used to walk a beat in his locality. So he was on his feet for the majority of the day, walking around 5 miles. It wasn't a purposeful walk, more of a slow stroll through the neighborhood, which puts a lot of strain on your lower back. He would then rotate through traffic control every couple of weeks, which required him to sit in a police car for the majority of the day. He states that the police car seats were the old bench-style seat, which just gave zero support to your back. And he did this for 30 years. So he denies any significant injuries or falls or any one incident that injured his back. Now, several days ago, he was painting a room while sitting in a chair. I am just as confused as you of how someone paints a room while sitting in a chair, but he did. But when he was sitting there, his lower back just locked up on him. So his pain is a constant dull ache, sharp pain with spine movement, and he denies any lower extremity involvement at all. Now, Jack is a heat lover, another person that when his lower back locks up on him, he goes straight to the heating pad, and he will sit with it for hours at a time. He takes a leave as well, but he has concerns about it as he is on other medications for a serious illness that is really taxing his liver. He also struggles when changing positions from sitting to standing. He has to forcibly push himself up with his arms to get himself fully upright. And riding in the car is also quite painful for him as well. and he is taken to sleeping on the floor, as this is more comfortable to him than sleeping in a bed. Now, our exam findings. He has a left antalgic lean. What this means is that, I'm just trying to see if my screen is in focus. So yeah, he has a left antalgic lean. So when you look at him, his pelvis and hips go right and his torso goes left. His lower back is the painful site. He denies any leg symptoms at all. His lumbar spine range of motion is pretty much nil in all planes of motion. His lower extremity muscle strength, reflexes, and sensation are within normal limits. His orthoneuro exam is inconclusive, meaning doesn't really give me too much information. But significant muscle spasms are noted in his lumbar region, strong enough to actually pull him to that left side. Now, his diagnosis, I'm cheating a little bit because I've known Jack for maybe off and on for about 10 years. His lower back is loaded with arthritis from L3 to L5. He was x-rayed about 10 years back, which revealed his condition. So from time to time, he does something weird like paint a room while sitting in a chair, and his lower back will just seize up on him. I'll see him for several weeks until we get his spine to calm down, and then off he goes on his merry way until the next episode. So he's also been diagnosed with myofasciitis, which is just inflammation of a muscle, and it's fascia. It's wraparound connective tissue. That is fascia. Now, arthritis, what is arthritis? It's a very broad and general term used to describe swelling, stiffness, or joint pain. The most common form of arthritis is osteoarthritis. Although amazingly, there are over 100 different types of arthritis out there. And it is out there. It affects 1 in 5 adults, or around 50 million Americans. That's a lot of people. So although commonly thought to be a disorder that affects older people, 2/3 of those affected are under the age of 65. And sadly, an estimated 300,000 children are affected as well. It's one of the top disability diagnoses in the United States behind, take a guess, low back pain. It is estimated that more than 20 million individuals have severe limitations on a daily basis. Costs to treat arthritis disorders are staggering, with it coming in at over $100 million a year annually. Half of that is from lost worker productivity and lost earnings. It causes more than 1 million hospitalizations in the United States alone and more than 45 million outpatient visits per year. So you can see that it places a tremendous burden onto our healthcare system and onto our employers and employees. Now, the signs and symptoms of arthritis. We have pain during or after joint movement. We have tenderness after applying deep pressure over a joint. But the hallmark sign of osteoarthritis is stiffness. Stiffness is the hallmark sign, and it's most notably after periods of inactivity. So usually I ask people how they feel after going to the movies and sitting for about 2 hours. When they get up, are you stiff? But once you get up and moving, do you loosen up? And after about 30 feet, you're good to go? That is the classic sign of osteoarthritis, stiffness after periods of inactivity. And you can also have loss of range of motion. The joint may not be able to get through its full range of motion. And there may be grinding sensation from the joint. you can get a lot of snap, crackle, and pop going on. Now, risk factors for arthritis. Just like we saw several weeks ago with a degenerating disc and there being a genetic link, there also appears to be a genetic link with arthritis. And I can personally say that rheumatoid arthritis runs in my family, with it affecting about half of my family members. Age is also a risk factor for developing many types of arthritis. And it increases with age, especially osteoarthritis. Osteoarthritis is a wear and tear on the joint. And obviously with aging comes more exposure to activities that wear on our joints. And sex. The autoimmune forms of arthritis, such as rheumatoid, lupus, and psoriatic arthritis, just love women. And gout, which is another form of arthritis caused by crystals forming in the joint space, has a male-dominant presentation. So, more risk factors. A previous joint injury is a risk factor for osteoarthritis. Injuries can be either of the acute type, such as from sports, or trauma, like a car accident or a fall. Or they can be cumulative, such as from a repetitive task. Examples of this is a poor sitting posture with the lumbar flex posture that places a lot of stress on the joints. Or from, say, playing a guitar. That's a repetitive motion all the time. So go out and Google an image of Keith Richards' hands. If you don't know who Keith Richards is, he was or is a guitarist for the Rolling Stones. Now, that guy has been playing guitar for over 60 years, and you can see the toll that it has taken on his fingers. They bend and twist all over the place and are just full of nodules. Now, obesity is another risk factor. And with the staggering rate at which obesity is climbing, not only in this country, but worldwide, we are sure to see the rates of arthritis climb even higher. The increased weight places more stress on the weight-bearing joints, such as your knees, hips, and spine, causing them damage for them and for them to wear out prematurely. Now, I wanted to show you this slide of a spinal motion unit, which is nothing more than two vertebrae, the disc that sits in between it. So these are the joints up here. This is the superior joint of this vertebra. Here is its inferior joint, which interacts with the superior joint of this vertebra. Our joints have a capsule, and that's what this is right here, this gray area. What I wanted you to note, though, on this vertebra is this area here. This is the cartilage. This is a slick, hard, it's made up of hyaline cartilage, and this is where the bones slide over each other, where the joints interact. And with osteoarthritis, we start to see damage to this cartilage. It begins to crack and degenerate and wear down. So this can actually wear down and become almost a bone-on-bone situation, which is very uncomfortable. So now back with Jack, our treatment begins. So we begin treatment at basically dealing with his symptoms, since we cannot cure his osteoarthritis. It is a permanent issue, can't reverse it, it's there. So we basically just chase after the symptoms and try to get him to feel better. So he has pain at L5, S1, and above, so we focus there. We choose electrical stimulation to reduce the spasms in his lower back, because if you remember, he was slid all the way to the side. His pelvis went right and his spine went left. So we're trying to break that spasm of the cycle of the spasm. We use manual therapy and myofascial release techniques in an attempt to get the muscles to relax, as well as to help get the stagnant blood and its associated waste products out of the muscles. Chiropractic manipulation is directed at L5S1 and is used to provide movement and motion at that segment. Now, if you remember from last week, what is part of everybody's therapy is what I call learning to protect you from you. Simple everyday tasks can irritate and are typically the cause of someone's troubles. Getting out of the bed, getting out of a chair, getting out of your car or up off the toilet. These are all activities of life that are problematic. Spine sparing techniques were taught to John. The principles of the hip hinge and abdominal stiffness were demonstrated. Also, no more heating pad. We switched him over to using ice. Now, a side note about the confusion of heat and ice. We talked about it last week, and I just want you guys to hear this one more time. It's all about blood flow. When you apply heat to something, it causes blood vessels to dilate, to get bigger. When we apply ice to something, it causes them to constrict. So when we have tissue damage or inflammation or irritation, it causes inflammation and it causes our blood vessels to leak. What causes that is histamine. So that's why you take an antihistamine when you have swelling. So heat brings more blood flow into the area, which increases swelling, and ice restricts the flow of blood into the area. So when in doubt, you can never go wrong with ice, but you can with heat. So when in doubt, choose ice. All right. And that basically wraps up my quick presentation. Just wanted to give you an overview of arthritis and our patient, Jack. So next time around, next Friday, we're going to be talking about pregnancy and back pain. So reach out to me. Here's my email, todd@backtalkinghelp.com. Let me know what problems you're having and what you're dealing with. And hopefully you'll all have a solution. So thanks for joining, and we'll catch you next time.